Welcome back. We got another series for you. So Achilles tendonopathy. We're going to go over anatomy and analogy. That's this post. Then we're going to add something new, a case example. So it's going to be an exact patient of a typical patient that I would see and correlate some of the subjective findings of, when does it bother you? How long has it been going on? What hurts it? What doesn't? So you kind of know if that fits your situation. And then two is some of the objective findings. If you've been following along, the FRST, the Functional Runner Screen tool, I'm going to go through a patient like this would typically get a low score on this criteria, just so it's all going to start coming together as far as fit in big picture overall view, correlating the running analysis and the objective and the subjective. So even if you're a clinician or runner yourself, hopefully there's something for everybody that you can get out of this. So without further ado, the anatomy, what makes up your Achilles? An Achilles tendon. Remember, ligaments go bone to bone, and ligaments are like duct tape, keeping things together. They're not stretchy, versus tendons are an extensuation of the muscle belly. So as the muscle comes down, boom, and before it inserts into the bone, it becomes this white, the tendon. So it's a different type of connective tissue. This is the contractile portion. So your Achilles is made up of technically three muscles, but we're not going to talk about the plantaris. It's a baby little muscle. Nobody really cares about it. No offense if you're a big plantaris fan. So we got the gastrocnemius. There's two heads of that. You have medial and lateral. That crosses the knee joint. And then we've got your soleus, which is underneath, and they both have the same function. You can see as the muscle contracts, it shortens, and whatever joint it crosses, it acts on that. So the ankle goes down or plantar flex when this muscle is activated and shortened. This is gonna be our analogy, so remember this later on because I'm gonna refer to this. Always think it helps to kind of simplify it. We've got the muscle, the calf. Think of this like a tennis net. You've got all these little squares, the contractile portion that can shorten and lengthen. We have the tendon. So it's still a part of the net, but it's different material. So we're gonna call this portion, this white part here, this rope, we're gonna call it. That's the tendon as the muscle belly goes down before it inserts into the bone. And then the bone, we're gonna say this is the bone. The calcaneus or the heel bone is the bone in this situation. So we'll be referring back to this as we go on when it comes to treatment, trigger points, all that kind of stuff. Okay, so let's clarify some things. Tendinopathy. Tendon means tendon. Pathy means pathology or injury. So tendinopathy is a broad term. You've heard the word tendinitis and tendinosis. I want to clear up what that is. So we're going to say this rope is in our example of the part of the net. That's what a normal tendon should look like. Tendinitis, itis means inflammation, is there is an active fire going on. Tissue's inflamed, it's not happy, it's irritable, there is active inflammation. That is tendinitis. Well then what's tendinosis? Tendinosis is there already was a fire, but the fire's out, but there's still the damage done. So you can see there's differences. This is where it already happened. You can see where the injury was. The last part of the anatomy that we're going to go over with this tendinopathy is we're going to categorize this in two different subcategories. We've got mid-substance is going to be the first type of Achilles tendinopathy. And the second one that we're going to talk about is insertional. Right as that tendon goes into the bone, that's insertional Achilles tendinopathy. So again, remember that. We're going to refer to the two because they are treated very differently. So I'm going to work on my brevity. I tend to get excited and be long-winded. I'm going to try so hard not to leave out any information, but be a little bit more concise with it. So I hope I'm successful with that. Stay tuned.